Hello, everyone. Today we will be presenting on alternative anthropometric measures on all-cause and cardiovascular disease-related mortality. I'm Seth.
I'm Julia.
I'm King.
And I'm Jeff.
Cardiovascular disease poses a severe public health threat. It's the leading cause of death globally, and obesity is a major risk factor. Obesity is commonly measured using body mass index. However, BMI varies inaccurately by race, gender, and adiposity differences. Therefore, we assessed body roundness index and waist to height ratio as alternative anthropometric measures. We use data from the National Health and Nutrition Examination Survey linked to the National Death Index, enabling us to assess sociodemographic information with decedent death information.
We investigated the general and cardiovascular mortality of the four different races in our dataset, including non-Hispanic white, non-Hispanic blacks, Hispanics, and other races, with a total of 31,244 samples. There are three findings from this project. The first finding is shown on the survival curves, where we compared how different categories of BMI, BRI, and waist to height ratio associate with general and cardiovascular mortality. We found that people that are underweight are more prone to both general and cardiovascular mortality. The second finding is the main finding of this poster. Different anthropometric measures are compared to find which one of them correlates the most with general and cardiovascular mortality, and we found that waist to height ratio has consistently the highest hazard ratio among all other anthropometric measures, associating with both mortalities. This means that for every unit increase in the waist to height ratio, there's a higher increase of risk in mortality compared to BMI and BRI.
So in conclusion, waist height ratio has the strongest association with all-cause and CVD-related mortality. And this is followed by BRI, body roundness index, and BMI, body mass index, being the least accurate. For racial disparity finding, which is our third finding of this poster, non-Hispanic Black females is actually associated with the highest proportion of obesity across all three anthropometric measures that we used. For non-Hispanic white males, they are associated with the highest rate of all-cause and CVD-related mortality.
Some future directions for this project include exploring the predictability of these and more anthropometric measures for prevalence rates in other CVD conditions such as heart attack, stroke, and cerebrovascular accident. We plan to investigate the high obesity rate in non-Hispanic Black females through varying biological and sociodemographic explanatory variables. Some limitations to this project were that we were not able to include waist circumference, a body shape index, or waist to hip ratio due to a small sample size. We were unable to obtain other race disaggregation from NHANES. Thank you.